Have your feet started swelling for no obvious reason? Do your shoes suddenly feel tighter by the evening, or do your socks leave deep marks around your ankles? While swelling often has common causes, it may also be a sign that your kidneys need attention, especially if it keeps happening. Healthy kidneys help remove excess salt and water from your body. When they don't work as efficiently, fluid can build up in the tissues, causing swelling, especially in the feet and ankles. However, kidneys are only one of several possible causes, and proper medical evaluation is important. In today's video, we'll explore 8 hidden kidney-related causes of swollen feet, explain why they happen, and discuss when swelling should be checked by a healthcare professional. Some of these causes may surprise you. One of the most common kidney-related reasons for swollen feet is fluid retention. Healthy kidneys continuously remove extra water and salt from your body. When kidney function becomes less efficient, excess fluid may begin collecting in the tissues, especially around the feet, ankles, and lower legs. However, heart disease, liver disease, and some medications can also cause fluid retention. Think of your kidneys as the body's natural filtration system. Every day, they carefully decide how much water and sodium to keep and how much to remove. When this balance is disrupted, gravity often causes extra fluid to settle in the lower part of the body, making your feet and ankles appear swollen by the end of the day. Swollen feet do not automatically mean kidney disease. But if the swelling lasts for several days, keeps getting worse, affects both feet, or appears together with foamy urine, high blood pressure, unusual fatigue, or changes in urination, it's important to consult a qualified healthcare professional. They may recommend urine tests, blood tests such as creatinine and eGFR, and other evaluations to determine the underlying cause. Another possible kidney-related cause of swollen feet is protein loss through the urine, also called proteinuria. Healthy kidneys normally keep important proteins, such as albumin, inside the bloodstream. When the kidney's tiny filters become damaged, some protein may leak into the urine. This doesn't happen in everyone with kidney disease, but it can occur in certain conditions. Protein acts like a sponge, helping keep fluid inside your blood vessels. If too much protein is lost in the urine, fluid may begin moving into nearby tissues instead. This can contribute to swelling in the feet, ankles, and sometimes even around the eyes. However, protein loss can have several different causes, and laboratory testing is needed to confirm it. Because protein in the urine often cannot be seen without testing, doctors usually recommend a urine albumin test or urine protein test if kidney disease is suspected. If swollen feet occur together with foamy urine, high blood pressure, or declining kidney function, these tests may help identify the underlying problem. High blood pressure is one of the leading causes of chronic kidney disease worldwide. Over time, consistently elevated blood pressure can place extra strain on the tiny blood vessels inside the kidneys. As these delicate filters become damaged, the kidneys may gradually lose their ability to remove excess fluid, which can contribute to swelling in the feet and ankles. Healthy kidneys and healthy blood pressure work together. The kidneys help regulate blood pressure by controlling fluid balance and releasing important hormones. At the same time, uncontrolled high blood pressure can damage the kidney's tiny filtering units. This creates a cycle where kidney problems may make blood pressure harder to control, and high blood pressure may further damage the kidneys. High blood pressure usually has no obvious symptoms, which is why it's often called the silent killer. If you have swollen feet along with repeatedly high blood pressure readings, foamy urine, fatigue, or declining kidney function, it's important to seek medical evaluation. Your healthcare professional may recommend regular blood pressure monitoring, urine testing, creatinine, and eGFR measurements. Do you enjoy salty snacks, processed foods, or restaurant meals? Eating too much sodium doesn't usually cause swollen feet overnight, but over time it can make your body hold on to extra water. If your kidneys are already under stress, this fluid buildup may become even more noticeable in the feet and ankles. Sodium helps regulate the body's fluid balance, but too much salt encourages the body to retain water. Healthy kidneys usually remove excess sodium efficiently. However, when kidney function declines, removing extra sodium becomes more difficult, increasing the likelihood of swelling and sometimes raising blood pressure as well. Reducing sodium intake may help some people manage fluid retention, particularly when recommended by their healthcare professional. However, swelling has many possible causes, so it's important not to assume salt is the only reason. If swelling continues despite lifestyle changes, medical evaluation is recommended to identify the underlying cause. One of the most important kidney-related causes of persistent swollen feet is chronic kidney disease, often called CKD. CKD develops gradually over months or years, and in its early stages, it may cause few or no noticeable symptoms. As kidney function declines, excess fluid can begin collecting in the feet and ankles. Chronic kidney disease does not happen overnight. It often develops slowly as the kidneys gradually lose their ability to filter waste products and excess fluid. Common risk factors include diabetes, high blood pressure, obesity, and older age. Because CKD may progress silently, regular health checkups become increasingly important. The good news is that early detection may help slow CKD progression for many people when appropriate medical treatment and lifestyle changes are started in time. If you have persistent swollen feet along with high blood pressure, diabetes, foamy urine, fatigue, or a family history of kidney disease, speak with a qualified healthcare professional. They may recommend creatinine, eGFR, and urine albumin testing to assess your kidney health. Did you know that diabetes is one of the leading causes of chronic kidney disease worldwide? Over many years, persistently high blood sugar can damage the tiny blood vessels inside the kidneys. As kidney function gradually declines, the body may begin retaining extra fluid, which can contribute to swelling in the feet and ankles. Healthy kidneys contain millions of tiny filtering units called nephrons. Persistently elevated blood glucose levels may gradually injure these delicate filters, allowing protein to leak into the urine and reducing the kidney's ability to remove excess water and waste. However, good blood sugar management may help reduce the risk of kidney damage for many people. If you have diabetes and notice persistent swollen feet, foamy urine, rising blood pressure, or unusual fatigue, it's important to have your kidney health checked regularly. Healthcare professionals commonly monitor HbA1c, urine albumin, creatinine, and eGFR to look for early signs of diabetic kidney disease. Your kidneys depend on a steady supply of blood to filter waste and maintain the body's fluid balance. If blood flow to the kidneys becomes reduced, they may not work as efficiently. In some people, this can contribute to fluid retention, which may lead to swelling in the feet and ankles. However, reduced kidney blood flow can occur for several different medical reasons and requires proper evaluation. The kidneys receive a large portion of the body's blood every minute. Healthy circulation allows them to filter waste products and regulate fluids effectively. If blood flow decreases because of dehydration, heart conditions, narrowed kidney arteries, or other medical problems, kidney performance may temporarily or permanently decline depending on the underlying cause. Reduced blood flow to the kidneys cannot be diagnosed from swelling alone. If swollen feet occur together with dizziness, low urine output, persistent fatigue, chest symptoms, or abnormal kidney blood tests, it's important to seek medical evaluation. Your healthcare professional may recommend blood tests, urine analysis, blood pressure monitoring, or imaging studies to identify the underlying cause. Swollen feet are not always an emergency, and in many cases they are caused by common conditions such as standing for long periods, hot weather, or certain medications. However, you should seek prompt medical attention if the swelling appears suddenly, becomes severe, affects only one leg with pain and redness, or is accompanied by chest pain, severe shortness of breath, or confusion. Medical evaluation becomes especially important when swollen feet occur together with foamy urine, blood in the urine, persistent high blood pressure, very low urine output, fever, or rapidly worsening fatigue. These symptoms do not automatically mean kidney disease, but they should never be ignored because they may indicate a condition that requires prompt diagnosis and treatment. The encouraging news is that many kidney conditions respond better when they're detected early. If swelling continues for several days or keeps returning, schedule an appointment with a qualified healthcare professional. Blood tests such as creatinine, eGFR, and a urine albumin test can help evaluate kidney function and identify the underlying cause. Swollen feet can have many different causes, and kidney disease is only one possibility. The key message is not to panic, but also not to ignore persistent swelling, especially if it appears together with other symptoms such as foamy urine, fatigue, high blood pressure, or changes in urination. Early medical evaluation can make a meaningful difference. If you found this video helpful, please like and subscribe to VitalBites. This is day 3 of our 90-day healthy aging series. Join us tomorrow for day 4 as we continue exploring evidence-based ways to protect your kidney health. This video is for educational purposes only and is not a substitute for professional medical advice. If you have persistent symptoms or concerns, please consult a qualified healthcare professional.